Now, from the News Channel 5 Network, this is Medical Mondays.
To you. Thank you for joining us for Medical Monday. I'm Carrie Sharp. So glad you're with us tonight. I have Dr. Prasertvit with me as well from the St. Thomas West area from Nashville Surgical Associates, general surgeon, here to talk about thyroid issues. Although you kind of run the gamut with all surgeries.
Right.
This is something that you specialize in and really see a lot of. So if you have a thyroid question tonight, if you're dealing with issues with that, contemplating surgery, having gone through surgery, we'd like to hear your experience. Have any questions about what surgery is like? Go ahead and give us a call. This is your chance to call in. We'll have that number on the screen coming up in just a little bit. Courtney, if you can tell me the number on my ear. I can't recall it off the top of my head. And we'll give it out to folks so we can get those calls lined up. So as soon as I can get that, I will pass it along to you. Dr. Prasertvit, let's just talk in broad scale right now about what the thyroid is. I know it's located in this area. What's it do?
So it's a gland. It's an organ in your body. It's kind of butterfly shaped, and it sits, just like you said, kind of on the front of the neck, above your collarbone, below your voice box, and it controls a lot of functions in your body. It produces thyroid hormones, and these hormones regulate how your body uses and stores energy, and so it's very important.
And I know that I often hear women talk about their thyroid not working correctly. Is it something that when things go wrong that it normally plagues women, or is that a misnomer?
So it's actually affected. Certain parts of the thyroid disease do affect more women. Thyroid nodules, for example, and growths and goiters and things are a little more prevalent in women than men.
Why is that? Do we know? No, just one of our crazy things that happens in our bodies.
Yes.
When things go wrong with the thyroid, what goes wrong?
So most common things with the thyroid, so the thyroid hormone levels from the medical side of the thyroid issues, you can have low thyroid hormone or high thyroid hormone, too high or too low, so hypothyroidism or hyperthyroidism, and both of these can be treated medically with medications and with the endocrinologist. The surgical side of it comes in when there's growths that aren't supposed to be there, such as thyroid nodules, which is just an area of the thyroid that has overgrown, or multinodular goiter, which is when a bunch of nodules form on the thyroid and form what's called a goiter, which is an overgrown thyroid. When that happens, that usually requires more attention from people like me, because they can have hidden cancers, they can have other diseases that we need to look into or remove in order to make sure the patient's not affected by it.
When you're talking about nodules and goiters, is this something that you would feel? How do people know that they have this?
So thyroid problems and thyroid nodules it's actually very common, and sometimes are palpable by the patient. So you may feel a knot or a nodule on your neck, and that's how some people do find them. Oftentimes it actually is found incidentally on some imaging. They may have gone in for a CT or an MRI of something for some other reason, and it's seen on there. Or their thyroid hormone levels are a little bit off, and so their doctor may have ordered an ultrasound. But usually if it's large enough, it can be palpable. The palpable ones do cause a lot more problems just because of the size. It can press on other things. Goiters, for example, the larger they are, they can cause compressive symptoms, difficulty breathing, difficulty swallowing. And even sometimes, difficulty laying down flat just because you feel like you're choking.
Oh gosh, that sounds terrible. Do want to mention we have the number up on the screen now. 615-737-PLUS is the number to call, or 7587. Again, if you have any questions about your thyroid, how it works, how it's not working perhaps, what options you have to deal with that, Dr. Prasertvit is the person to answer your call tonight. Free medical advice. You can't beat that tonight. So go ahead and give us a call. We'll get those lined up. When something is going wrong with the thyroid in the body, what are some symptoms that people would notice?
So if it's just from the thyroid levels, so say your body is not producing enough thyroid hormone, so you have hypothyroidism or low thyroid hormone levels, you can feel sluggish, you can feel tired, you could have brittle nails, hair that's falling out more than normal. These or basic kind of symptoms if your hormone levels are low, or even cold intolerance where you just feel, too hot, too cold. For high levels of thyroid hormone, you would feel your heart racing, or what we call palpitations, heat intolerance, and just kind of mood swing, mood changes, not feeling right. And those are kind of the medical side. If the thyroid hormones are not normal. For thyroid nodules, it's things like we talked about. You may feel, although most of them are asymptomatic, you may feel a nodule that you can feel, and that's pressing up against other structures on the inside.
Now, you mentioned the big C word, cancer, thyroid cancer. How prevalent is that? So
majority of thyroid nodules are actually not cancerous. About 95% or so of the thyroid nodules are benign. But the 5% that contain cancer, it's one of those cancers that affect both men and women, but it's a cancer that we can cure if we detect it. And for the most part, the 5-year survival for thyroid cancer is very, very high. And so it's one of those that if we are vigilant about it and we find it and we see it, we can definitely make a difference.
That is good news, and we're going to dive into that today as well. Let's go to Lavelle, though. He's on the phone. Lavelle, thank you for calling in.
Hi.
Oh, I'm sorry, I called you Heath. Thank you, Lavelle, for calling in. Go ahead with your question.
I was wanting to ask a question. I had gotten diagnosed about 2 years ago, and it said that I had a cyst on my thyroid. And the doctor that I was seeing, he actually left town. So now I'm kind of wanting to get some information on what I should do.
Okay. Not knowing all of your medical records from that, I can tell you, findings of a cyst are common. What you usually need to do in that situation is get back in to either see, someone like myself in thyroid surgery or an endocrinologist. And what we normally do in that situation is start you off by checking your hormone levels and also looking at an ultrasound of your neck. If you haven't had that done recently, that's kind of the first steps in our diagnosis. And once we see what we see, if there's a cyst or abnormal growth or a nodule, you may require a biopsy of that to determine what the next course of action is.
All right, Lavelle, and just so you know that we will be giving that number throughout the show of how to get a hold of Dr. Prasertvit. So get a pen and paper handy and we'll get that to you, okay? Thank you for calling in.
Thank you.
Thank you.
All right, take care. Carl's also on the line. Carl, thank you for being with us. What's your question?
My question is, I have a growth. I've been diagnosed. I have a growth, and I'm supposed to go to UofL to have, the further the situation take care of. Does it cause problems with your vocals?
You say you're having a growth on your thyroid, and you're asking if it has causes problems with your vocals, your vocal cords?
Yeah, I'm saying what I'm trying to say. Yeah, so I'm having problems right now, with my vocals.
Okay, okay.
So the question was about if growths on your thyroid can affect your voice or your vocal cords. Certainly because of the position that the thyroid is in or where it is in your neck. If the thyroid growths or nodules are compressing on the vocal cords, it can cause some level of voice changes and hoarseness. If you have things that evolve from that, like a cancer or a tumor, it can grow into the vocal cords. I'm not sure in your case, what exactly is going on, but if that's happening to you, I would definitely encourage finding more answers about it and seeking some medical attention so we can figure out what's going on.
Okay, I'd like to get the number so I can come see you if possible.
Okay, Carl, we'll be giving that out, so grab that pen and paper. We're going to take a quick break. When we come back, we'll make sure to give that number out, so stay with us.
This week on Fishin' Affliction TV.
Oh my gosh, big dog.
Join Team Fishin' Affliction as they continue with part 2 of the Lost Episode series, Flippin' and Pitchin' on Kentucky Lake with Brent Anderson.
Come on. Come on.
Your Fishin' Affliction TV weekend begins Saturdays at 5 p.m. right here on News Channel 5 Plus, your home for
Fishin' Affliction.
If you want to shed the fat and sculpt your core to get those sexy toned abs of your dreams, then stop doing sit-ups.
Say what?
And start dancing with Hip Hop Abs, the fun new ab sculpting system from Insanity creator Shaun T.
I don't want you to ever get down on the floor to do crunches again. I'm gonna break it down so you burn the fat and sculpt those abs fast.
Just do Shaun's easy-to-follow moves to work your upper abs, middle abs, lower abs, and obliques, all while you're dancing.
I went from a size 18 to a size 2. I have abs now. I've got a six-pack.
And now the complete $80 Hip Hop Abs system is 75% off. That's right, Hip Hop Abs is only $19.95. We'll even upgrade you to express shipping free. Get the complete Hip Hop Abs system for only $19.95.
Call 1-800-339-1045 or order online at gethiphopabs.com. That's 1-800-339-1045. Call now.
She stands in the face of evil and will not lose hope or faith. America, the land of freedom, is still the home of the brave. So raise the banner. America will always stand. History will write the story. America will always stand.
Welcome back to Medical Monday. As promised, if you have a question sparked by tonight, if you would like to go see Dr. Prasertvit, here's the number to get you started. It's the referral line, 615-986-6033, 615-986-6033. Call that number, talk to them about what your problem is. They're going to get you to the right doctor. You may even mention Dr. Prasertvit's name, and they can head you in that direction. You can also send an email to medicalmondays@ouradvancedhealth.com. There you go. Dr. Prasertvit is here talking about thyroid surgery tonight. We're taking your phone calls. We're going to jump right to the phones. If you have a question, go ahead and give us a call. 737+ is the number. We have Patricia on the line. Patricia, thank you for calling in. What's your question?
Hey.
Hi.
Okay, my question is, I had an ultrasound done, and it showed that I have a 4 millimeter, I think, cyst on my thyroid. And it said that I went to the doctor because I was feeling, something in my throat, and which I still feel it every day, all day. It's there. So what the doctor prescribed was omeprazole and said that it would come back in 6 weeks or so, and we will see how that does. Me, myself, I don't think it's related to heartburn, acid reflux, or whatever, that is. But, of course, I'm going to take the medicine and see in 6 weeks if it don't work. Then he said probably we would do a swallowing study. Does that sound about right, or,
Do you need a second opinion, perhaps?
Yeah.
Okay. Well, let's see what Dr. Prasertvit has to say. Would this be the normal, plan of action?
Well, not having the report in front of me, I can't tell you for sure all the details of what your ultrasound showed. If it's only a 4 millimeter, and not centimeter, but millimeter nodule, the likelihood that is pressing on your swallowing mechanism enough that's causing that trouble is low. It's not impossible, but it's low. And so I think that it's okay to pursue other reasons why they were looking to see what other things could be causing your trouble swallowing. Now, 4 centimeter thyroid nodule could certainly, press on some things to the point where you might be having difficulty swallowing. But if it's just 4 millimeters, it's very small. I don't see that they would be doing anything wrong by pursuing other common things like heartburn or reflux to be the cause of your swallowing problems. But not knowing all the details of your ultrasound, I can't tell you that for sure. But if you're having questions about it and you want to be seen so that we can make sure that we're going down the right route, that's certainly reasonable.
All right. Hopefully that'll help you out, Patricia. It can be confusing, and even how you kind of end up in your office. There is a process to it. Can you walk me through that? Because people can come from 2 different avenues.
Yes. So some patients are seen by their primary care or their GYN, if you're a female, who act as some women's primary care, and they say, oh, I felt this knot in my neck, or on lab work this was abnormal, and they get sent for an ultrasound, at which point there's something wrong with the thyroid, they immediately get sent to a surgeon. That's certainly one way that they get to my office. If that's the route, then after that what I would do is do the workup with the ultrasound if they haven't had one already, and if there is an abnormality, order an ultrasound guided biopsy. That's usually called a fine needle aspiration. That's done by the radiologist using the ultrasound as a guidance, because not all nodules are palpable, and so we use that technology to be able to see exactly what we're biopsying to make sure we're getting the right tissue. Once we get the results from that, then we determine the next phase of the treatment, and that could be several things. The other way that patients get to me is if they see their primary care, they get sent to their endocrinologist first. The endocrinologist is a special medical doctor that takes care of these types of problems medically. Like if you had high thyroid, low thyroid, they would be the ones that normally see you first. And sometimes they order the ultrasound and the ultrasound biopsy, and you end up coming to me after that. Not all patients that have thyroid troubles, thyroid problems need surgery, and so it just depends on each case individually. But no matter which way, once you get to me and you get biopsied, based on the biopsy results, then together we determine what our next course of action is, which may involve surgery.
Well, let's talk about the different surgeries. What's out there, what can be done, and what does that biopsy tell you?
So your results from biopsies, I like to explain it kind of in 3 broad categories. One is if it's completely benign. They get the biopsy, they can tell, the pathologist looks at it, and they say it's completely benign, there's nothing wrong. That, depending on the size of that nodule, we may just watch it. And the pathologist is a special doctor that basically take that biopsy and look under the microscope at every cell of the sample that we had. The other end of it is if they say this is definitely cancerous, we need to have surgery, then we have the conversation of what surgery you should have based on the size and other characteristics of what we know about your disease process. The middle is a little bit more vague. The middle is if the biopsy comes back non-diagnostic, which means they may not have gotten enough tissue, and we may need to repeat the fine needle aspiration. The other way is we have a couple of categories of what's called cells of atypia of undetermined significance, which means they see something abnormal, but they're not really sure. And there are types of cells or types of cancers that show up on these fine needle aspirations, but they're not, the pathologist can't tell for sure if they're cancerous or not. They're just abnormal cells, and those might be follicular neoplasms. In those cases, we would do surgery to take a better tissue so we know what we're dealing with. And when we talk about surgery, the 2 types, main big groups of surgeries, either if we take half of your thyroid or total or all of your thyroid. So a thyroid lobectomy, there's a right and a left lobe, so depending on where your nodule is or your abnormality is, we may take one side and leave the other, versus the total, which means we take both sides. And the determination of which we do depends on the size of your nodule, what's going on with the other side, and what your biopsy shows.
Once you get in there, for surgery, are you able to look at the thyroid and say, this whole one needs to come out? Is it usually pretty apparent, or are you really relying on what you see under the microscope?
It's really important for the pathologist to be able to tell us, because, you know, a nodule on the outside, we're not, it's sometimes very, very, you know, not often. You can say this feels like a cancer, this is something bad, but a lot of times those are the ones that we've already had the biopsy and we know that contains some type of cancer. But no, from the outside, we need the pathologist to slice up every little cell and really look at it under the microscope to know for sure. And sometimes that could be, you know, a little unnerving that we get in there, we take that out, and we don't have an answer for at least, you know, some, depending on how fast the pathology is, sometimes 5 days, sometimes 7 days.
Yeah, that's a long time to wait, even though in the grand scheme of things it's not, but I'm sure it feels like that. With the lobectomy, what is the success rate of not having to go back in, take the other side in the long run?
So it depends, and that's a lot of times a conversation we have with the patient. The benefits of doing just the lobectomy, if they are euthyroid or have normal thyroid levels already, is that taking one side out, the other side can usually compensate, and you may not need supplemental thyroid hormone. As we talked about earlier, the thyroid is very important, so not having one, you have to take a medication to supplement the function for the rest of your life. And those medications, you know, are have been around a long time, and they're readily available and they work great. But with taking the medications, that's, you know, each patient's different. They don't like taking medicines and things like that. So that's a big concern for a lot of people. So sometimes, with, you know, the ones that are in the middle, the biopsies are in the middle, we give them a choice of whether to just take half or to take the whole. If it's cancerous, we definitely take all of your thyroid if it's, you know, of a certain size. There are some very, you know, rare occurrences where you have a diagnosis of cancer and we only take half a size just because it's a very small cancer. But in benign nodules or nodules that we're not sure, oftentimes we give the patient a choice. We can go ahead and just take half, and depending on what the pathology showed, if it comes back cancerous, then we have to go back in and take the other half.
Are you mainly just doing the surgeries for cells that come back cancerous, or what if it comes back completely benign but it's still bothersome?
Yes.
Do you do surgery?
Yes. So those are going to be along more the lines of the goiters, the growths that have grown so much that it's compressing on the windpipe or airway, causing difficulty breathing, sometimes even a little cough, and or compressing on the vocal cords, like one of our callers had asked, and causing some hoarseness and discomfort with that. Or even sometimes if the nodules are on the posterior side of the thyroid, it can actually compress your esophagus or swallow tube and can cause difficulty swallowing. There's some, you know, very massive goiters that can do those things, and so even though they're benign, they're causing symptoms, and those are what we call symptomatic goiters, and we do also do surgery in those cases.
Okay, when we come back, I want to talk about the pros and cons of surgery, what people should expect if they're anticipating this. So stay tuned. Of course, we'll give you those numbers again. The number to call in tonight to get advice from Dr. Prasertvit, 615-737+. We'll take a quick break, and we'll be right back.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Cloudy skies returning to the mid-state, although temperatures staying mild. Now, with these clouds will come rain by the time we head towards Tuesday. So don't expect the same amount of sunshine we had Sunday afternoon, but you can expect this mild weather to continue. Speaking of temperatures, this is what it looks like across the southeast, anywhere from 15 to 20 degrees above average, widespread across the southeast. Current conditions here in Nashville. A reminder to you, this is updated on the hour. Now, overnight tonight, we drop down to 55 with that cloud cover steadily increasing. We'll have a gentle breeze out of the south between 5 and 10. That will pump moisture into the area as well. So by the time we get to your Tuesday afternoon, expect about a 40% chance to see scattered showers throughout the morning, afternoon, and even into the evening. Slight rain chances will linger into both Wednesday and Thursday before a cold front brings showers and storms with breezy conditions on Friday.
Who did you spend Valentine's night with? This guy? We were just hanging out. I hang out with a lot of friends and we never hang out like that.
We ain't gotta keep this on the low.
People make a big deal that you date younger men. I'm attracted to their spirit, their soul, their body, whatever. Yes. We're going to help Jen find a new boyfriend. I could do either.
Tomorrow at 3 on News Channel 5.
14 lives lost.
We opened the door, the whole hillside down there was on fire.
Millions of dollars in damage.
If I'd only had a warning, we would have gone.
We may have reached a new threshold of fire hazard.
A team of News Channel 5 journalists returns to the Smoky Mountains.
We take a closer look at lessons learned and where things go from here.
Watch Fire on the Mountain, Friday at 6:30.
Welcome back to Medical Monday. I'm here with Dr. Prasertvit from Nashville Surgical Associates. Dr. Prasertvit is a general surgeon, although you do a lot of thyroid cancer surgeries or just thyroid surgery in general. We have a caller on the line. I want to get to Marilyn, but then we'll talk about the different surgery and what people can expect from it. Marilyn, you are on with us. Go ahead with your question tonight.
Yes, about 6 years ago I was diagnosed with low thyroid, and I've been on medication ever since. I was just wondering, is this something I'll have to stay on the rest of my life?
So that's a little bit more of the medical aspect of the thyroid disease, but very possibly you may have to stay on that medication for the rest of your life. The endocrinologist, which I'm sure you have one and are seeing, or your primary care physicians, are often the ones that manage your levels. So they check your hormone levels with blood work every 3 or 6 months, and they kind of monitor based on that whether to go up or down on your doses. But often, yes, you would, once you start having these problems, you would have to have supplementation for the rest of your life.
Marilyn, thank you for being part of the show. And you were talking about this is really kind of a twofold thing. You have your endocrinologist or your primary care doc looking at different issues, and then once they say this is probably something that needs addressed through surgery, that's when people wind up in your office. So you are the expert on the surgery side. What do you tell your patients what to expect from thyroid surgery?
Well, I go from the very, very, basic level. Often when they come and see me, I actually draw out the schematic of what surgery we do, kind of what parts we take, what things are sitting around there, so they kind of know on the inside, even though they can't see, what we're doing. And I write down, what the diagnosis is that we're doing the surgery for, kind of going down one by one. And so one of the very first things to know about surgery, just like most surgeries, you can't have anything to eat or drink after midnight. For thyroid surgery, most patients come in that morning for surgery, and they'll have one overnight stay and go home the next day. That stay often is determined by how well they're doing after the surgery, as well as their calcium levels. We check that just because, as I'm going to talk about some of the risks and benefits of having the surgery, your thyroid sits right in the middle of your neck, but also there are these little glands that sit either on your thyroid, behind your thyroid. They're called parathyroid gland, or what's called next to the gland, and they are very important in regulating your calcium levels. And so we take the thyroid out, trying to keep those glands, the parathyroid glands, unbruised, uninjured, and so a lot of times, in order to make sure that they are doing fine and aren't going to change up your calcium levels too much, we do check that and keep you overnight so we can make sure that your levels are okay. Part of the reason for that is because your calcium controls a lot of things in your body, muscle contraction, and a lot of different chemistries in your body. But that's one night stay in the hospital. From that standpoint, the main incision that we use is called a collar incision, usually in one of the creases of the neck. Depending on how high your creases are, we may be able to use one of the crease and hide that scar in there. We go in there, we take just the thyroid out while keeping the other structures safe, and those things are things like the parathyroid and other important structures that we watch out for and monitor to make sure that we're keeping it in its place is what's called the recurrent laryngeal nerve, and that's an important nerve to control your voice. And so that's why when the gentleman was talking about can the thyroid affect your voice, it certainly can, just because of this nerve. So what we do in surgery is we do what's called nerve monitoring. We have special probes that we can check that run signal from the probe wherever we're touching, connected to electrodes that are already on the breathing tube when the patient are going to sleep, to check to make sure the nerve's functional while we're operating and make sure that it's unharmed. So, you know, if that gets affected, it can cause hoarseness and things like that. So we do some of that when they hear nerve monitoring. That's what that's for. But then, you know, they go in, they have the parts of the thyroid removed without you know, harming other things, and the closure, we close all the little layers back up, and the skin's usually closed with an absorbable suture, and you have a kind of dissolvable glue-like dressing on the outside. So it's kind of like a plastics closure, not very much scarring, unless you're just the person that's prone to scar.
Sure. How long of a cut are you making?
Depends on the size of your thyroid.
That's my next question. How big is this thyroid?
So the thyroid normally is not very big, and if we're taking out just for a nodule purposes, your incision could be anywhere from 3 to 5 centimeters in general, which is not very large. But if you have a very large goiter, we make it as big as we need to get it out. You'd be surprised, lots of people walking around with a large neck. A lot of that could be from the thyroid that's just overgrown.
Wow, that's incredible. And I read in some of my notes that some people are starting to do endoscopic surgery.
Yes.
How common is this? And explain what that is.
So that, just so it's, you know, kind of a minimally invasive laparoscopic surgery. It's not very common right now because it's the thyroid is one of those organs that are sitting kind of closer to the surface. So to get to it through that, the benefits and risks are, you know, not very much more, just because you're trying to hide the incision or trying to get to it from, you know, something deep and coming up to something that's superficial when it's just sitting right there.
Gotcha. So it's new, but not necessarily the best way to go about things, perhaps.
Correct.
Gotcha. Okay. With every surgery, there are risks, and you talked about maybe damage to the vocal cords or this nerve. What other risks that should people know about?
So the main risks of any time you have surgery: risk of infection, risk of bleeding, risk of hurting things that live near and around where we're operating in. In this case, like we talked about, you know, those parathyroid glands, and that can cause, if they get bruised or they just, you know, don't like that we're sitting, you know, working around them, that can cause low calciums. The nerve that we're watching for, your voice nerve, that can cause hoarseness. And then risk of seromas or hematomas, which are basically fluid collections, either from, you know, blood clot or just your body, whenever we take anything out, tends to try to fill that space with fluid. And so a lot of times that's temporary, but they may notice some swelling and things like that for, you know, a little bit before that goes away. Very rarely would we have to drain that with a needle, and very rarely these swellings or hematomas or blood clots and bleeding could come to the point where you know, it requires emergency airway trouble. But majority of those risks and all the things that we've talked about are very low in regards to this surgery. But it's kind of, I always tell my patients, it's kind of like you've decided that you're crossing the road. You know there are cars coming, and so you're very, very careful. But you know, you still have to know that the cars are there and what risks there are to crossing that road. And so I always explain all the risks and benefits, even though, you know, the chances of those things are happening.
How often can, or how quickly can somebody be back to work after this?
I always talk about giving them about 2 weeks off, but it depends on what they do for work. I've had patients that, you know, have this done and go back to work in 3 or 4 days just because they feel fine and feel great. The hospital stay, as we talk about, is usually just overnight, and after they go home, you know, some people have a little more discomfort, some people have less, and so it just depends. But you come back and see me about a week after the surgery. If everything goes fine, I usually give the green light. If you want to go back to work, you can. If you want to wait a full 2 weeks, that's fine as well. But in general, it's the downtime is low.
Can you eat and drink, or does it hurt afterwards?
A lot of the most common complaints from the sore throat is actually from having to go to sleep for the surgery and having the endotracheal tube down for the anesthesia. The soreness a little bit, just because anytime obviously you have surgery, you're going to be a little sore, and sometimes it's more from the positioning that we put you in surgery. In order to make sure that we get the best exposure, we often put your head back and put you on some rolls, and so that can cause a little bit of soreness in your muscle in the back of your neck. But other than that, it's pretty minimal.
Wow. How many of these surgeries do you think that you've done?
I've done quite a few. I don't know that I have a good number off the top of my head.
But you kind of got into this niche from your schooling and your mentorship, you were telling me, so you've done quite a few. Okay, let's hop back to the lines here. Mary is on the line. Mary, thank you for being part of Medical Monday tonight. What's your question?
Yes, hi, thank you for taking my call. My mother has had parathyroid problems, and they have tried to perform, well, actually they have performed the surgery already 3 times, but they cannot get to one of the parathyroids. And I was just wondering how safe it is to keep trying, or if it's just better to leave it there and deal with the problems in a different way with medication and so on and so forth, instead of just keep trying to remove it.
So not having all of her medical records, I don't know the details of what they've done and what they have found and what they haven't found. So I can't answer to how difficult the search has been. But often for parathyroid surgery, most people have 4 glands. Some people have a little bit less, some people have more, but the majority of people have 4 glands, and they are located normally in the fixed position that we think we can find, but not everybody's body reads the textbooks, and so there are some of those patients where the glands are somewhere where they're not normally, or they're not the usual positions, so they can make it very difficult to find, and so whether or not it's worth to go back in and out of surgery. Multiple surgery, usually for neck surgery, the more surgeries you have, it increases the risk just because of the scar tissue and those kinds of things in terms of trying to go back in and find more spots or parathyroids. But it's hard to say whether that's more dangerous or not doing surgery is more dangerous, or which one is the better option without knowing more information, just because if her calcium levels are changing so much that they are drastic that they need to do the surgery, that could be one way, or maybe they're not and they can manage it medically. And so not knowing all the details, I can't give you all the information or the answer, but hopefully that helps you some.
Yeah, hopefully so. And talking about that parathyroid, we talked about it a little bit earlier, the different little glands outside of the thyroid. What are the trouble that they cause? Same thing as the thyroid?
No. So the parathyroids control calcium levels. And so a lot of times the calcium levels would be elevated or high if the parathyroids are overactive or overgrowth. About 80% of the time it's just one of the glands that's overactive. About 15% of the time it's a little bit of all the glands, and then about that 5% of the time is where there's 2 of the 4 and things like that. They usually are found when patients have routine lab work and their calcium levels are high. A lot of times the symptoms from that are things that you wouldn't even attribute to just the parathyroid gland, just because, as we talked about before, calcium affects so much of what your body does that the symptoms are a little vague. And we always talk about the mnemonic, or not mnemonic, but words to remember the symptoms for hypercalcemia or high calcium, things like stones, bones, moans, and groans. And so kidney stones, bone pain, or fractures, because the calcium's getting leached out of your bones in order to make your levels higher. Moans are kind of your muscular aches and pains, or even kind of your fatigue and not feeling clear, those types of things, which are, a lot of times if you ask anybody, are you fatigued?
Yes.
Are you tired? Yes. And so how can you attribute that to just that? So it's a little bit harder to diagnose than the thyroid.
That is tricky, for sure. Okay, we got lots of callers on the line. Let's hop to Bill. Bill, thank you for being with us. What's your question?
Yes, I have a question for the doctor.
Okay.
My doctor says that my thyroid numbers are good, 2.57. But I have a lot of symptoms, according to a medical book that I read, such as cold hands and feet, itchy eyes, dry skin, insomnia, and I have a book from Books A Million with a doctor that says that to find a doctor that treats your thyroid by symptoms and not by numbers. Could she answer that question?
Okay, that's a good question, Bill. And put you on hold. Listen to your TV for the answer here. This can be a frustrating spot. Your doctor's telling you one thing, you're doing research, whether in a book or online, you're reading something else. What do you do?
So in these cases, and I don't know, all the details of your medical records and everything like that, but sometimes what you read isn't, all that there is to be seen. So when we treat patients, we kind of take, not just your number, but kind of all the picture all together. Whether or not the symptoms are attributed to your thyroid, I'm not really sure. Like I said, some of these symptoms can be caused from other things, but altogether they could be related to your thyroid. But if you've had your thyroid levels checked, the likelihood that if your numbers are normal, that these symptoms are related are low. But if you have any question about that at all, one of the doctors that deal with this a lot and kind of are experts at these things are the endocrinologists, which are the medical doctors that manage thyroid hormones and levels. And so that might be someone that you can seek out and maybe get a second opinion if you're worried about that.
Yeah, Bill, take that next step and see if you can't get these questions answered. Okay, we're going to have to take a quick break. When we come back, much more of your phone calls, so stick around.
If you want to shed the fat and sculpt your body to get that slim, sexy look of your dreams, then you need to stop working out.
Say what?
And start rocking out with Rockin' Body, the fun new body makeover system that was created by fitness expert and Insanity creator Shaun T.
Rockin' Body combines dance and fitness in a fun new way so you can achieve insane weight loss.
I lost 30 pounds dancing.
Now you can tone and tighten your abs, shrink and shape your hips and thighs, and lift and firm your booty, all while you're just dancing.
I've lost 33 pounds. I feel sexy.
And now, for a limited time, the complete $80 Rockin' Body system is 75% off. That's right, Rockin' Body is only $19.95. We'll even upgrade you to express shipping free. Get the complete Rockin' Body system for only $19.95.
Call 1-800-307-0417 or order online at rockabody.com. 1-800-307-0417. Call now.
Restaurant secrets.
We have the inside scoop.
Next, Inside Edition. What you need to know before your next dinner out.
This bread may have been at another table.
What to look for to make sure everything is clean.
So the bathroom tells you a lot about the restaurant.
It really does.
And
what is the secret to scoring a last-minute reservation?
then, triplet beauties. Wait till you see what happened when we had their DNA tested. Next, Inside Edition.
Tomorrow at 4:30 on News Channel 5.
If we want to improve America's healthcare system, let's start by improving the health of Americans. Despite the best doctors, hospitals, and medical advancements, Americans are not as healthy as they should be. We spend too much on treatment and not enough on wellness and prevention. We need a system based on primary care. When patients have a medical home and a long-term relationship with a doctor, the result is a longer, healthier life and reduced medical costs for everyone. Let's make America a place where health is primary.
You're frightened every day that you see him. My body cringed. I didn't know what to do. I didn't know what to say. My mind went just blank, like, wow. Did he really just ask that? Like, did that really just happen? I wanted to punch him, but I couldn't. He's the law. An officer of the law can do these things and just walk away and still be getting up and putting that badge on.
We don't think about fire safety and smoke alarms until we have a major emergency. And you know what? These smoke alarms, think about it for you. I know me, like everybody else, until something starts beeping and then you reach up and you grab your smoke alarm, you're like, God, it makes a lot of noise and all that. And you don't think about it again until potentially you have a real serious issue. When an emergency happens, it's too late. So get ahead of this thing.
To request a free smoke alarm, visit tn.gov/fire.
Welcome back to Medical Monday. We're talking about thyroid surgery today and everything that leads up to it and what comes after it. I have Dr. Prasertvit here from Nashville Surgical Associates. You can find him in the St. Thomas West building. We got a question from Facebook that we want to answer. Jack from Murfreesboro wrote in. Jack, thank you for watching, by the way. How would someone know if they have thyroid cancer? Anything to watch out for? Great question.
So thyroid cancer is usually, a diagnosis we get after all these other things that we talked about. Usually it's found after we have gone through the ultrasound, the biopsy, and either the biopsy comes back as thyroid cancer or, it's suspicious for cancer, or we're not really sure, and then we go and do the surgery and it's actually cancer. There's not a specific sign or symptom to watch out for, but just that, it starts off with the nodule. So if you have a suspicious nodule or something where, your doctor's recommended biopsy, or you find that you have a palpable mass on your neck, that's usually the general way of starting that process. And usually it starts with, you have a growth or a nodule on your neck. Then we go through and do ultrasound to see if, what that looks like, what the characteristics are, and then from there the biopsy, and then get the results, whether it's for sure one and we already know the answer, or we need to do surgery to find out. But there's not a specific
would you not be having the same type of symptoms if your thyroid is overactive or underactive?
Not necessarily. Thyroid cancers usually don't cause, high levels or changing in levels. They're often what we call, the cold nodules, or they're not overactive.
Okay.
And so they don't really cause the changes in the thyroid hormones like you would think.
Okay. Good question, Jack. Thank you for writing in. We appreciate it. We also have some folks on the line. Let's talk to Brenda. Hi, Brenda. What's your question tonight?
My question is, I have nodules on my thyroid. On the right side of my thyroid, they're hot. On the left side, the nodule is cold. And I was wondering if she would recommend removing the whole thyroid or just half of it.
Okay, go ahead and listen to your TV. I'm going to put you on hold so you can get that answer.
So the hot or cold is one of the, on one of the imaging tests called thyroid scan, that kind of gives you the results of whether it's hot or cold based on whether a nodule is hyperfunctioning or hypofunctioning, or cold or not overactive. That doesn't really give us the information of whether you need your whole thyroid removed or half a thyroid removed. What really gives us the function or the decision is if those nodules have been biopsied, and if any of them are abnormal in terms of, they have cells that contain atypia or follicular neoplasms, or suspicious for malignancy. That's when we kind of steer you, if both sides have those types of nodules, we tend to steer you toward taking total or doing a total thyroidectomy, or taking the entire thyroid out. Hot nodules in general aren't necessarily more prevalent to be cancerous. Usually those are the cold ones. However, not having the biopsy results, we can't really say one way or the other. And the other thing is, sometimes the thyroid's taken out because your whole thyroid, or these nodules are so overactive that it's causing you trouble, and there's not a worry for malignancy or cancer, but it's just that it's so overactive, there's not medications that control it well enough. And so that's going to be more of a question that you need to work up more in terms of endocrinologists, or even seeing us as a surgery.
Okay, Brenda, thank you for calling in. We also have Martha on the line. I want to get to as many people as we can here in this last segment. Martha, what's your question?
I had a couple questions. First one is, my mother had thyroid cancer back in the 70s, and I think she was about 50-something at the time, and they did take her thyroid, and she was on Synthroid, or whatever that is, for the rest of her life. And so I'm wondering if the technology has changed based on what I just said. If they, if it's possible that they wouldn't have had to take the thyroid in its entirety, and she wouldn't have had to take the medication, and also the genetic component as far as I'm concerned. And then also she had a first cousin once removed who died of suicide back in the 30s when she's about 44 years old at the time. But she had a goiter, and I noticed that you indicated that the goiter is somehow related. So I'm wondering about their genetic component, and then also if in those days, if a diagnosis like that, what kind of treatment they had, and if something like that could have just led somebody to suicide if there had been more things involved.
Okay, Martha, that's a lot to get to. We'll see if we can get to all that. Let's talk about her mother's surgery. I think she said back in the 50s. Have the technology, the technique of the surgery changed much?
So the biggest thing is being able to tell on the front end what you have going on with you. So from the, needle biopsy standpoint, that helps us direct, whether you need half the thyroid, whole thyroid, that kind of stuff more. And I don't know that it would have changed what she had done had the biopsy had shown, cancer already. She would have had total thyroidectomy, depending on the size of it. But the Synthroid for the rest of your life, that is still true, because we really haven't found anything better to substitute the thyroid function in your body other than giving you thyroid hormone. And so that point is still the same.
Are there many complaints that come from that drug, from patients who are taking it and have been on it for a while who say, I just hate this because?
Most people hate it because they have to take it every day. But the symptoms are going to be because you're taking supplemental thyroid hormone. The symptoms are the same as if you were having low thyroid hormone or high thyroid hormone. And so, if you're not feeling right and you're already on thyroid hormone, you need to see a physician to have that level checked to make sure it's in the right range.
Okay. And also I want to go back to her question about genetics. Great question, because when we talk about cancer, there's often a genetic component. Is there with this kind of cancer?
There is a type of thyroid cancer that's genetic, but that's related to the MEN2, that's the medullary thyroid cancer. The other ones, not so much. In terms of goiters can be seen in families where, I had a mother who had an enlarged thyroid or had a thyroid nodule. It had to be removed. But the other types of cancers are not as much genetically related as, the medullary type, and those are usually found in very young patients and are very rare.
Is it the best idea, if you are concerned about something along that line, just always have your thyroid checked at your annual exam? Can you do that?
Yes. So the start of that is just physical exam. With anything, medical, the first thing we do is on your yearly physical. In general, those levels may be checked depending on your age already by routine lab work. But if you have concerns about your thyroid, or you're not feeling right, feeling extra tired, or you start having, the shakes and palpitations or rapid heart rates, and you're really worried about it, you can certainly ask your primary care doctor to check those levels and go from there. But it is one of those things that I point out again, that if we find the problem, we can fix it. And especially for cancer, we can remove that and give you very, very good survival rates.
After you do the removal of the thyroid for cancer, is there the radiation, the chemo that usually follows?
So the majority of the cancers do not need radiation or chemo. Actually, neck radiation, if you've had it in the past, is actually a risk factor for developing thyroid cancer down the road. What they do with cancer treatments for thyroid cancer is you do the surgery, which is the main treatment, and depending on factors that we find on your pathology, the size and whether it's spread outside of the thyroid, you may need radiation with iodine, so radioactive iodine, not real radiation with beams. And then after that, suppressive therapy, where they put you on hormone suppressant, where we don't want the stimulation to cause any more growth in any little cells that it's left.
Great information. All right, we're going to take another quick break. We'll be right back with more Medical Monday after this. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
Cloudy skies returning to the mid-state, although temperatures staying mild. Now, with these clouds will come rain by the time we head towards Tuesday. So don't expect the same amount of sunshine we had Sunday afternoon, but you can expect this mild weather to continue. Speaking of temperatures, this is what it looks like across the southeast. Anywhere from 15 to 20 degrees above average, widespread across the southeast. Current conditions here in Nashville. A reminder to you, this is updated on the hour. Now, overnight tonight, we drop down to 55 with that cloud cover steadily increasing. We'll have a gentle breeze out of the south between 5 and 10. That will pump moisture into the area as well. So by the time we get to your Tuesday afternoon, expect about a 40% chance to see scattered showers throughout the morning, afternoon, and even into the evening. Slight rain chances will linger into both Wednesday and Thursday before a cold front brings showers and storms with breezy conditions on Friday.
As a mother, you don't want to have to worry about this bill is coming, but then she needs this chemo. That's a decision you shouldn't have to make.
El que Sayud no cobra ni un centavo para nosotros significa quitarnos todo ese estrés, esa preocupación y podernos enfocar en nuestra hija.
That was the first thing I was like, how are we going to do this? When St. Jude told us that we didn't have to pay a single bill, I was like, wow. They pretty much have saved us.
It's like the world has been lifted off of your shoulders, and now your focus is supporting this child.
There is not another hospital like St. Jude. The patient care is unmatchable. It saved my life. It saved my daughter's life. It saved our family.
Thank you for being with us for Medical Monday. Dr. Prasertvit here to answer your calls on thyroid surgery. Hopefully, just like me, you've learned a lot about this. Final thoughts on thyroid surgery or thyroid problems in general?
As we kind of summed it up for over, our hour, thyroid troubles, if there's anything with it that you kind of suspect there's a problem, please do, seek medical attention so that way we can know, if there is a nodule or if it's just low or high levels. If there is a nodule, there's always a risk of hidden cancer. And this is one of those problems where a cancer that we can treat very easily and give you very good survival rates. And so if we find the problem, we can fix it, so to speak.
That's great news, because often we don't hear that kind of news when we're talking about cancer. So that is some good news to end on. Also, tell me about Nashville Surgical Associates.
So we are a group of 4 surgeons. We're located in St. Thomas West, 302 in the Medical Plaza. It's myself and my 3 partners, Dr. Ballinger, Dr. Cohen, and Dr. Hargreaves. We have our 3 medical assistants that work with us, and that's kind of, the way that we work. It's a more personal approach, and so you'll get to know us just coming to our office.
All right, Dr. Prasertvit, thank you for lending your expertise tonight. Another way to track him down, the number or the email on the screen. Thank you again for being with us for Medical Monday. We will see you next week.